to host this great session about where to call when you have questions about any aging programs and services. Our speaker today is Cara Polino, who has a background in developmental disabilities and has been working in the Aging Network since 2006. Cara was instrumental in the development and implementation of Georgia's first non-Medicaid consumer-directed program called Support Options. She joined the Aging Independence Services Group at the Atlanta Regional Commission in 2014, starting as a program manager in the Aging and Disability Resource Connection, and we say ADRC as the acronym, but we're not going to get hung up on that today. She first had direct oversight of the ADRC, as well as the innovative expansion programs such as behavioral health program and diabetes health coaching program that linked together and worked cooperatively with the ADRC. In her new role as Access to Services Unit Manager, she now has a broader oversight role over multiple programs, including the ADRC, Community Options Counseling, the ePro Resources Team, and the Medicaid Waiver and Community Transitions Unit. Cara has a bachelor's degree in English literature from St. Bonaventure University in Newark, as well as a bachelor's in psychology from Kennesaw State University. Will you join me in welcoming Cara, my former colleague at ARC, and her wealth of knowledge to today's presentation. Thank you, Cara, for doing this. We really appreciate it.
Thanks, Maureen. And I'm happy to see some familiar faces in the audience. So I have a lot of slides and I have a lot of information, and we only have an hour. I want to leave time for questions, but I wanted to give you guys a broad snapshot of aging services and then get really into the details.
Yes, so, Cara, we're going to ask everyone to keep their questions to the end, but if you'd like to put it into the chat, feel free to do it during the presentation and we'll make sure those questions get asked. Thank you. Sorry, Cara, for needing.
Yeah, no problem. No problem. So we'll start with a broader overview, then we'll focus on the Aging and Disability Resource Connection, which is really the front door to aging services. And I'll be talking with you about what that means, what's available, who's eligible, how the process works. So I wanted to, oh no. So sorry, I'm getting an internet connection unstable. So let's just do, there you go. Okay, I wanted you guys to see this slide. By 2040, 1 in 4 Metro Atlanta residents will be over the age of 60. In 2000, that was 1 in 10. So this, I just wanted you to see how quickly the over 60 population is growing and the need for services. And again, I won't go into detail, but for those of you who don't know how aging services is funded, for the Older Americans Act funding, we get money from the federal government. It comes to our state units on aging or Division of Aging Services in Georgia. That comes to the area agencies on aging, and then that is funneled to the counties and into and other service providers. So this is, well, there are multiple funding sources for aging services. The Older Americans Act is the biggest driver of funding for us still to this day. And just for those of you who don't know, the Older Americans Act was passed in 1965, and it was really a response by concerned policymakers because there really was no streamlined service coordination for older adults. And that started the splitting areas into area agencies on aging and ADRCs and really getting services out to the public. Our aging services, area agency on aging, is also called Aging and Independent Services. I don't want you to get confused with any of the names, but it is confusing. We're called the AAA, we're called the Area Agency on Aging. Atlanta's is called Aging and Independent Services, and then some people call it the ADRC, which it's not. This is the broad Area Agency on Aging, and the ADRC is a part of that. Okay, so very quickly, the Area Agency on Aging, all of them, there are 12 in Georgia. Every county in every state in the United States is covered by an Area Agency on Aging. And really what it does is at a smaller level, it's planning for services for older adults and people with disabilities, as well as direct services. And I'm going to go into some of this now. I don't want to take too much time, but I just wanted you to see these are the buckets of service that the area agencies on aging or the AAAs are really tasked with. So the state does it at a state level, we do it at an agency level, and then we funnel money to the counties to kind of do the same thing at a county level. This is, if you see this logo, that is Georgia's new by about a year, Aging and Disability Resource Connection logo. So that's the state of Georgia's logo. An ADRC, or an Aging and Disability Resource Connection, it's not a place, it just serves as an entry point to services. Some people call it the no wrong door, some people call it gateway, the front door to service. The goal is to really help people, empower them to make informed choices and to provide easier access to long-term support. ADRCs are trusted places, they're free. People can turn for information on a full range of long-term supports. And we're also not biased. We're not getting money from agencies who want us to promote their services. We are non-judgmental, unbiased, trusted service. I wanted you to see this. I'm going to give you all of the Atlanta region's information. I want you to see the state number. You really don't have to use that if you're in our region. You can just use our ARC number. But nationally, I really want to make sure all of you are aware of eldercare.acl.gov. If you have someone, if you're working with someone who maybe is caring for someone in another state or another region of Georgia, and you're not sure which ADRC that is, if you go to eldercare.gov and enter, you can search by county or zip, and we put that zip code in and it will take you, for any state in the United States, it will take you to that service area's ADRC. So do make sure I will put that in one of your favorites because I go to it all the time. And this, for a little more name confusion, our ADRC was rebranded to Empowerline recently. And while I won't show the video now, I don't want to take the time to show the video. I do, when you get the presentation, there's a link in the notes section, and I'd love if you want to go visit it. Or you can go to empowerline.org, and it gives you some information about services that are available and how to access those services. This is our map. It's very small. It's the state of Georgia and how it's broken down. And here you can see the Atlanta region is right up here. Again, just for you to have a sense of how the regions are broken down. Okay, now I went through the other stuff very quickly because that was the broader overview. Now we're talking about the Atlanta region's Aging and Disability Resource Connection, that front door to services, how you can access services or how the people you work with can access services. All of them, every ADRC and every AAA are different, but all of them have a few core services in common. Based on funding or additional programs, it may look a little bit different. We cannot do any of this alone. We depend on an extensive partner network to provide really a full suite of home and community-based services. So we do information and referral assistance, and I'm going to go through all of these in more detail. Intake and screening for programs, options counseling, caregiver programs, resource curating, and initiatives and special projects. So when you call the ADRC, you are talking to certified counselors. They're certified by the Alliance of Information and Referral Systems. Most of our counselors are licensed social workers. We have a nurse. We have very, very skilled professional people. These counselors provide the assurance and information families need when seeking those critical supports and services to remain in their communities. The approach is always person-centered and unbiased. And the tool that they use and that's used across the state is called ePro or Empowerline Pro. And I tell you that because one, it's such a thorough curated database. It's a long-term care database, so you can look for any service that anyone's calling and asking about. And then also for professionals, I will say that you can also access this through a subscription. So both, I want you to see it as a tool that the counselors use, and then we have another version that would be, you will be able to subscribe to. We get about 70,000 requests for assistance annually. Okay, so why would someone call the ADRC? And this, I really want people to understand. If you think, if you are yourself or you're caring for someone who's an older adult or someone with a disability, and there is some kind of need, call us. Call us. You don't have to be Medicaid eligible for all services. You don't have to be completely physically impaired for services. We talk to people who are still driving, who are very independent. People might just want information on maybe exercise classes or the local senior center. They may be interested in assistive technology. And then we also, of course, have people who are calling us in extreme crisis. A lot of caregivers calling for help, especially now with COVID. More caregivers are having to step in to take the place of services that were coming into the home, and people are now a little bit frightened of that. So caregivers are, again, stepping up. And people just might want to know what resources are available. Farmers markets, continued education for adults. And then we also get a lot of calls, especially, and it's very timely, after Thanksgiving, after Christmas, after New Year, we'll get calls from families saying, I just saw my mom over the holiday. I didn't realize the state she was in. She tells me she's fine on the phone, but when I saw her, I see she really needs help. The bottom line is, if you think there's a need and the person, there's an older adult or person with disability, have them call us and we'll go through what their needs might be. And if it's not a service we do directly, we will warm transfer them to that other service. The most common caller requests, transportation, housing, and in-home services. I will see since COVID, we've seen a huge increase in calls for grocery delivery, even over home delivered meals, and then help with utility payments. Now I see most of the people in the audience are professionals, but I just wanted to I wanted to tie a client back to the services I'm about to tell you about. We're going to use Alice and her daughter Rita, and we're going to use them in a few different situations. We'll say that Alice is 82 years old. She recently lost her husband, who was her caregiver. She lives alone in her own home. Her daughter Rita lives nearby, but Rita has a family and works full time. Alice is diagnosed with Parkinson's, and her daughter suspects she may be starting to have some memory loss. Okay, so Rita calls us and she says, my mom's having some issues. HCBS services are home and community-based services. And again, you don't need to know what any of this is. If you think there's a need, you call us and we'll help walk you through this. Home and community-based services, when we talk about this in our network, this is non-Medicaid Older Americans Act services. The eligibility for this, you have to be 60 years of age or older. It's Older Americans Act money. Unless someone is diagnosed with Alzheimer's or related dementia. In that case, it can be someone under 60. We're looking at prioritizing services for those most in need. Across all programs, that's our goal. But we are tasked to do this. So we're looking at people in most economic and social need and risk of institutionalization and the frailty level. So these services, let's say Rita calls us and she says, my mom has Parkinson's. She's still able to get around a bit and do most of her, most things for herself, but she does need help. She really can't cook anymore because she's shaking. And she's unsteady on her feet and afraid of falling. She's had a history of falls. So our counselor would talk to them about HCBS services. This is the list of home and community-based services, all of the services. At ARC, we screen for meals, do intake and screening for meals, homemaker, personal care and respite. I will say that home modification, repair and chore service is a service that's offered, but it is, there is not a lot of funding, and it depends on which county you live in to see really if that's available for you. So it may be that Alice, the client, is going to be screened for home delivered meals and maybe some homemaker. They would see that she's 60, she has a need. She lives alone, so that puts her up on the wait list. But there are wait lists, and with non-Medicaid services, of course, funding's tied to all services, but with non-Medicaid services, we're stretching those a lot. So you might not get, you may get a few hours of service a week. We're not talking about if someone needs 8 hours of service 5 days a week, this is probably not the best option for you. So if the counselor is talking to them and this is not the best option for them, maybe she needs more help than this. This I'm going to skip over. I'm sorry, I got ahead of myself. For anything I talk about here, don't worry about the process for applying. We will help you through it. But I just, for you to see it, I wanted you to see what the screening, the time it takes for the screening and then what it looks like. But the only thing you need to remember is for you or the person you're working with to call the 404-463-3333. That's the only thing you need to know about eligibility. You don't feel like you have to remember all of this. So maybe Rita thinks that her mom, Alice, really does need a little bit more help than that. And she is suspecting dementia and she's very worried about her. So we look at Georgia's elderly and disabled waivers. These are Medicaid waivers. The two elderly and disabled waivers are CCSP and SOURCE. They're acronyms: Community Care Services Program, and SOURCE is Service Options Using Resources in Community Environments, which I know is, who can remember that? It's silly. But ultimately what this is community-based care as an alternative to nursing home placement. So this goes back to the waiver being, unfortunately, currently, it's been like this since the beginning, the default is for someone who is highly impaired and needs a high level of care and is Medicaid eligible, the default is nursing home placement. The waiver means instead of serving you in a nursing home, we're going to take that money and serve you in the community. So this helps keep people in their homes and their communities. But it is Medicaid, so there are certain eligibility criteria. There does need to be functional impairment caused by physical limitations, but dementia counts here as a physical limitation. There has to be an unmet need. They must meet level of care for nursing home. And you guys, again, you don't need to remember this. This is just so you have an idea. They must be Medicaid eligible or potentially eligible. And of course, because Medicaid, it's limited income and resources. But even with that, if someone calls or you're working with someone and you think, I'm not sure if they're Medicaid eligible, they have some resources, they're a married couple, have them call anyway, because there are times when we often refer people to legal aid because there are, there's something called spousal diversion, and there's a way to make it work if someone needs the service and there's one part of a couple going into service. So never think that it's so complex. Medicaid is so complex that I would hate for anyone to say, I don't think I'm eligible, I'm not going to call. Call anyway and see what's available. And then these services they're really similar to HCBS. It's adult day, it's alternative living, which is your personal care homes, home delivered meals, and home delivered services. I will say the skilled nursing and the physical speech and occupational therapy is, again, sometimes limited based on the provider. So what we would do, again, just call us. For CCSP, we screen directly. For SOURCE, we would talk to the person, give them a list of SOURCE case management agencies, and right now the case management agencies screen for that. It wasn't always that way, but that's the way it is now. If you think someone has they really need some help physically in the home, they're not able to transfer, they're having difficulty toileting, you think the need is greater than just what HCBS services may be able to provide, this would be where you go, EDWP. Now I will say, a lot of people who are eligible for EDWP refuse it because there is a cost share. And for 2020, this will go up in 2021, but the cost share may be as high as all of a person's income over 783, which is the current SSI limit. And also Medicaid estate recovery applies. So people can have an incredibly high cost share. They can be paying $500-600 in cost share. Or we also hear a lot that people own their own homes and they've worked all their lives for this home and they want to leave it to their kids and they don't want Medicaid estate recovery. So we talk about all this with them. We refer them to the Medicaid estate recovery office if they're concerned about that. But just so you know, we do have many people who are eligible and opt out because of the cost share and because of Medicaid estate recovery. Again, just call us, either EDWP or CCSP or SOURCE, just call us. The next thing I want to talk about is community options counseling. This is another, right now it's a free service. Options counseling it's an interactive decision support process. So for people who call us, and maybe they're either extremely overwhelmed, maybe an extremely overwhelmed caregiver, and you've given them 4 different steps to, they have to go to Social Security office and get this paperwork before they apply for this. They have to contact a family member to discuss that. If you're working with someone, maybe limited mental capacity, someone who's stressed and just can't keep it together alone, if they're interested, options counseling provides, it's a 4 to 6 week process, but it provides kind of a coaching decision support for clients or their caregivers. We're not making decisions for people, but we're really helping them in their deliberations to determine appropriate long-term care choices in the context of that person's needs, preferences, values, and circumstances. It's the foundation for options counseling is a robust information and assistance program. They would still talk about any needs you have, any gaps in services, but they're with you a little longer. It's not just a one call in and you're screened and placed on a wait list or put into services. You're going to have a certified options counselor with you for 4 to 6 weeks. It might be longer, it might be less time, and you're helping them through a process. You have helped them, you've worked with them on establishing an action plan and goals, and you're just there to support them through the process. This is a free service right now. This, to me, is one of the most underused services, and I would love to see an increase in this. MDSQ options counseling, this is just an FYI. This is for nursing home residents. Options counseling, community options counseling is for people currently in the community. MDSQ options counseling is for people in the nursing home who would like more information about returning to the community. Not a commitment to leave at all, but our MDSQ options counselors are in the nursing homes working with people face-to-face who have voiced a desire to leave the nursing home. They will talk to them about options, supports, what programs may be available. Again, it's very robust. We're not telling anyone what to do, but it's a coaching and support process. Another program that I would love to see an increase in referrals, BRI Care Consultation. This is a free telephone-based information and support services for adults with health challenges and their family or friends. It's a year-long program. It provides ongoing help to find practical solutions to concerns about health and care for themselves and the people they're caring for. It's an award-winning, evidence-based program, and it has been shown to result in improved care, less stress for the caregiver, fewer visits to the ER, and delayed nursing home placement. Again, the core of this is solid, robust INR. We're still talking to people about types of assistance that might be needed. We're telling them about community services, health-related information. We're trying to get them involved. Maybe if they don't have a very big support group, we'll help them map out how to get more family and friends involved, and coaching and support. Right now, this is a free program. It's a year-long program. And for this, I will tell you, you can still call the ADRC. For every single thing I'm telling you, you can call the ADRC. But David is going to post on the Thanks Mom and Dad website the BRI brochure. And there is a direct number for Ginger Reagans, who is over that program, and she does the work. But either way, if you call the ADRC, we're going to get you where you need to go. We also have evidence-based programs. And right now, we're not doing a lot of, we're not doing any of the face-to-face programs, but we do have at ARC, Healthy Changes for Living with Diabetes, Powerful Tools for Caregivers, Healthy Changes for Living with Chronic Conditions, and A Matter of Balance. These are all classes that before COVID, they were in person. Now we're doing some level of virtual classes, but these are classes for people who really want to learn. Someone was just recently diagnosed with diabetes, or they've had diabetes for a long time. Maybe it's someone who who's had a chronic condition and just would really like more information. The programs vary a little, but they're typically 6 to 8 week programs with classes meeting once per week. It's an intense program. We have tremendous results. We get tremendous feedback about the programs. We usually ask different agencies if they'd sponsor it, because we don't want to charge the clients for it. And so the clients usually do not have to pay. But if someone is interested in this, if someone is a new caregiver, they might be interested in Powerful Tools for Caregiving. And they can do more than one. They can do the evidence-based program, Powerful Tools. They can be in receiving BRI care consultation, and their loved one can also be receiving CCSP. So this is not a just choose one. We're really looking at the full person holistically, what their needs and preferences are, what their family's needs and preferences are, and we're trying to give them every available opportunity to really thrive where they are now. This, you would call us, but David's going to post the brochure for the evidence-based programs as well. Now, those are kind of the core services in normal everyday life. When COVID happened, things changed for all of us, as I don't have to tell you, you all know. So the first thing we did, we revised our postcards that we send out or we give out, and these are going to be posted too. So we just wanted people to know, we know things are changing. We know there's a pandemic. We know you might need things that you didn't need before. We're still here. Call us. We're not just here for traditional services. Call us and let us know how we can help you. So really what happened immediately is that more people are staying home. So we're looking at increases in social isolation, the need for delivery of food, not just home delivered meals, but groceries, also of medicine and supplies. Senior centers were closed. So people, who were going for congregate meals were now having to receive home delivered. Transportation changed. A lot of people stopped transporting. And then clients, a lot of them were worried about having, if they had a home health worker coming into their home, they would be afraid to have anyone come in. So they'd say, I want to put my services on hold for right now. So some of them were left without the help that they previously had. This is a little dry, but just so you guys know, this is the money that we've gotten at our area agency on aging has gotten. It's Families First, which is federal. It's CARES Act, which is federal. It was the Greater Atlanta COVID, which was philanthropy. It was Thanks Mom and Dad, which was the very first funding. It was the easiest to access. It was the easiest to use. And it was the first funding that got out the door to actually help people. And that was Thanks Mom and Dad. And then Senior Hunger Funds. So I wanted to tell you, this money's been used, but using Thanks Mom and Dad, money. It was $15,000. For this, we said it would be age 50 plus. This was really the core of COVID services that we have now. This set the stage for what we have now, even though this funding is done. And this was used specifically for COVID related emergency needs. Someone has no food, they can't go out to the store. Someone, their daughter used to get them continence supplies, and the daughter's now unemployed because of COVID, and there's no continence supplies in the home. Can we get it ordered? It was material aid, including nutrition, supplies, and assistive technology. This was the best. It was just the best use of money. We still don't have access to some of the federal funds, but this we had access to. With that $50,000, we served 78 clients, a lot of food boxes, home delivered meals. The food boxes supplied 2 weeks worth of groceries. We were able to repair someone's wheelchair. We had incontinence and cleaning supply orders. We had help with utility payments that people were not able to pay because they were laid off because of COVID. Assistive technology orders, 11 of them. We were able to get people tablets who, for the first time, the doctors at first weren't doing an office visit, so they were doing telehealth, or the senior centers who were closed were now doing virtual programming. The tablets help people access that and reduce social isolation. We had an AC repair assistance and a medical supply order. But I can't, we're so thankful for the Thanks Mom and Dad money. It literally was the first money that we could use, and the first people to need the most immediate help received help because of Thanks Mom and Dad. The CARES Act, I'm not going to go through all of this, but I'm going through the two that would help this group the most and the people that you serve. So with the ARC CARES Act, we are implementing a consumer-directed program. I'm going to talk a little bit more about that, but ultimately it's clients would have access to a flexible monthly budget to use as they would like to use it, including being able to hire caregivers, including family caregivers. And then also emergency material aid we would continue to do. Consumer-directed service. Now, these services that I'm talking about are COVID-related services. Now, it's not the first services I talked about, CCSP, BRI, care consultation. Those are all traditional services, whether or not someone's impacted by COVID. These now are using COVID funds, so these programs will be in place until the funding is out in September of 2021. Consumer-directed services, if you yourself or you're working with someone who has been impacted by COVID, this is a 6-month program. The client or authorized representative chooses the services and goods that best meet that need. So that could be what we're using it for now. We had a person who their daughter was, they were privately paying for a staff to come into the home. They couldn't continue doing that. The daughter got laid off from work. This budget would allow them to either continue paying the staff that had come in the home, or they could now pay their daughter to provide that care, which has been helpful for those people who have lost employment as a result of COVID. Consumer-directed services are not typically so short, but because it's COVID related, we said it would be a 6-month program. If depending on need, we can be more flexible. The budget can be used for anything that maintains or improves clients' independence, allows the client to remain in the community, and reduces caregiver burden. So for instance, if we have someone else who is, she was going into work, had no caregiver, she was taking her mother who has dementia in with her to work. Her boss was being very gracious. The mother was starting to have more and more behaviors, including a lot of toileting accidents. And the daughter contacted us and was panicked that she would lose her job if she had to keep caring for her mother. So they are now accessing this program, and they are paying an agency to come in and provide care to the mom so the daughter doesn't have to take the mom to work. The monthly service budget for this program is $475. It's a 6-month enrollment period. And the clients really, they can use their budget to purchase traditional services. So if, they want to purchase a traditional home delivered meal, 5 a week, they can do that. If they want to work with, maybe they're getting, they had been getting HCBS services, but that stopped for some reason. They can still work with that agency and pay for that. But they can also purchase assistive technology, continence supplies, anything that can speak to reducing caregiver burden or maintaining independence. If you ask that question, does it do these things? And the answer is yes, then it's a very flexible program. It's a consumer direction. This non-Medicaid is one of the truest forms of consumer direction. And that you can hire your own employees, including family, is huge, especially as people are working fewer hours or have been reduced to no working hours because of COVID. And then we're working with the fiscal intermediary service, who's processing all the state and federal employment paperwork. So again, the burden is on the fiscal intermediary, all the federal and state mandates. We have staff that is working directly with anyone enrolled to help, again, coaching. We always want to coach, provide information, help people succeed. So they would have someone that they would work with, because consumer direction is a new concept for a lot of people. And we wouldn't just say, here's the program, go forth and be merry. We are there to help them. We are there to help them with that. And then material aid assistive technology. This again, Thanks Mom and Dad Fund set the stage for us to do this. While that money is gone, we do have $50,000 still in ADRC CARES Act funding. There is no age requirement for this. They have been very flexible with this, but people must have some kind of disability. But it's a self-reported disability. So I don't want anyone thinking that unless you have a medical diagnosis, don't call in. We have a lot of people who call in and they just, for whatever reason, they don't go to the doctor, or the doctor hasn't been able to figure out what's happening. You might hear things like, I have trouble getting around now. I have trouble in the shower. I can't lift my legs. I can't lift my arms. If someone is reporting that would fall into this category of having a disability. The need must be related to COVID-19 though. Again, all of this money, this COVID money, has to be tied back to COVID. We also have $10,000 in ADRC supportive services. And for this, there is an age requirement. So must be at least 60 years of age. That's the only difference. The ADRC CARES, no age requirement. Supportive services, there is the 60 plus, because we're using it's Older Americans Act funded services. But this is for people, if you're working with people, or if you yourself are, and even if you're okay right now, I know we're all watching the news and numbers are going up again. If we get to the point where we're on another lockdown, or people are needing emergency food, grocery delivery, personal protective equipment, utility assistance has been a big one, as people are not working and their utility bills are piling up. And the utility companies have been amazing at saying, we're not going to expect payment. But now, of course, the time has come when they do, and people are really, really in a pickle. And then assistive technology, which can be tablets. It can be something as simple as, an opener that helps someone with maybe some arthritis be able to open jars more easily. It could be special utensils for someone who has Parkinson's and shakes a lot. It could be a weighted utensil that helps them. Could be dishes and bowls that suction cup down if someone only has use of maybe their right hand or their left hand. Bed handles, grab bars, anything that's going to help someone. Again, it has to be tied back to COVID. But as I've said before, never hesitate if you're working with someone who has a need, or if you yourself have a need. Even if we're not the place, I hope that's not the case. I don't think that will be the case, but just call us. Just call that main 3333 number. So that I went through that more quickly than I thought, and I'm glad because I wanted to give time for questions. So I guess David or Maureen, are we open for questions now?
Yes, and we had one come, well, actually, there's about 4 questions on the table. The first one is from Mary Edie. Is this available for those, and I think she's talking about the COVID. Is this available for those who were on CCSP before COVID, or is it open to anyone to apply? Mary, can you be specific about the program that you were asking? Is it, yeah.
Hi, it's
Hi.
Mary Ellen. Hi,
Oh,
Maureen.
Mary Ellen. Yay.
I came in a little bit late, but I was trying to understand. I saw the COVID self-directed option, and I didn't know if that was just for people who are already receiving it. So I just wanted a little clarification.
The people who are already receiving the CCSP?
Yes.
Okay, no, this is completely different. I think you,
Okay.
there is the structured family caregiver, which is part of CCSP. And then there's also the consumer directed option as part of CCSP. This is completely different. You could not though access CCSP and the consumer directed option.
Okay.
It would have to be one or the other, but this is completely separate. This isn't part of CCSP consumer direction.
Gosh, just sorry for the confusion. And also,
No, I'm glad you asked.
will this presentation be available somewhere also?
Yes, it's going to be on the Thanks Mom and Dad Fund website. It'll be uploaded this afternoon, but give it a little time to make its way through cyberspace. So by later tonight or in the morning, you should see all of the information materials as well as the actual presentation. And we will leave it there for you or anyone who wishes to see it. Yes.
Great. Thank you, ladies.
That's thanksmomanddadfund.org. Couple of other questions, Kara, I wanted to put out on the table. You mentioned the list of service providers is unbiased, but it's most likely reviewed for legitimacy or current licensees, et cetera.
Oh, yes.
How is that screened? Is that being done?
Yes. We, in our database, we have 3 staff dedicated to updating those resources. So once a year, at the very least, all 26,000 resources in their providers are contacted. Some of them are contacted more frequently, like personal care home providers, in-home service providers. They are contacted, they provide any updated information. And it's a voluntary, being in ePro, which is our resource database, is voluntary. Providers are not mandated to do that. But for CCSP providers, DCH sends us lists directly of providers. So we know everyone, if you are not licensed, you are not in ePro. We have very stringent inclusion criteria. We never want to recommend something and then God forbid someone ends up in an unlicensed personal care home. Everyone there's some form of oversight in all of the services that are listed. So we are unbiased, but the services are vetted and regularly, so they're updated. We currently have a 97% updated compliance rate for the Atlanta region, so we have excellent resources. And we add more regularly.
So one of the other things, I understand the waiting list for services offered by the county or the state, but if a person has the means to pay for the services, can they still be helped with information about private pay services that are available? It's not just.
I'm so glad. Thank you. Whoever asked that, thank you. Yes. And our counselors do talk to everyone about private paying as well. They get yelled at sometimes when they talk about that, but they do talk about that because yes, absolutely. People can private pay for all of the services.
So it doesn't matter anybody's income. Anybody with any income can call you and you will help guide them to where they need to go.
That's exactly right.
Oh, that's great. So what's a warm transfer?
A warm transfer, and I think I saw Linda Blackwell on the call. Linda's with DBHDD and she's one of our partners. So when I say warm transfer, we have, as I said, an extensive partner network. So we wouldn't just say call DBHDD. We would connect with Linda and kind of work on what needs the client had, make that introduction and work together if we need. And often we do need to work together because people are sometimes straddling two different systems. So that warm transfer really speaks to our partners in the community, our relationships with them, that we're not just sending someone to a generic phone number. We're really kind of the friends and families line.
Well, I have another comment to make. That's all the questions that I see here. Does anybody else who's on the line want to ask a question? Wave your hand or unmute yourself. No? Well,
I do.
Oh, good, Paul, yes.
Okay. I'm very new employee, so but not new to services. I worked in nonprofit for a lot of years. I guess my question is there one place or is there a resource directory that that we could acquire? Because this information is awesome to give to well, to share with our beneficiaries and as Medicare counselors. Is there any one place or one directory that we can get these, a list of these services and numbers?
Yeah, our resource and education unit, who does all the resources and the updating in the database, they also are responsible for the information included in printing in the annual resource directory. The information we have is, of course, more, you can really drill down a lot more. It's not as, what we have is much more detailed than what we would share with the public. But
Right.
If you go to empowerline.org, we have an electronic version of that resource database.
Okay.
But even more exciting is to be launching soon is it's called Empowerline Self-Service. I'm so sorry. I think it's self-service. And that would be a public-facing website where people can go and search for services. So that is the final point. It's just being finalized now, and it should be launched very soon. And when that launches, I'll be sure to send that to Maureen and David. And if they want to put that on the Thanks Mom and Dad website, we'd love for that to happen. So
Great.
you know that's out there. But right now, if you go to empowerline.org, you can get the electronic copy of our resource database.
Wonderful. Thank you.
Just knowing who you are and how this is done, I want to tease that out a little bit more for Paul's sake. Paul, as you might be able to tell from what Kara's already said, there's a lot of information and things do change. So your written directory has a more likelihood of being outdated before your online information. However, your online information is going to be limited, and they know that, and that's why they have the backup of the counselors who can take you on a deeper dive of what's available. So, I mean, the beauty of this is that you have so many layers and opportunities and even subscriptions for people who are doing it, who needs some more additional information. So like professionals.
Right.
Yeah.
You,
Hey, Maureen.
yes, is somebody else?
This is Linda Blackwell,
Hi,
and I work for DBHDD, but one of the things I wanted to say, piggybacking off of what Kara said, is the beauty of our partnership with DBHDD. It is a collaboration, and I'm hoping, and we all work together to try to collaborate between multiple agencies and that kind of thing together to be able to help folks. So that's the beauty of this partnership. I just wanted to mention, so like Kara said, it wouldn't necessarily even have to be somebody with a developmental disability. They might contact me because I'm a person. I'm the ADRC person with DBHDD, and there's 4 of us. But at the same time, we reach out to our partners at Atlanta Regional Commission and so forth. And so we connect people. Sometimes we get comments like people having trouble with their Medicaid, for instance, you know, getting somebody defects in this COVID world. And so I just wanted to just mention to you guys on the call and, you know, that it's the days of having a directory where we could go to and they're long gone. It
Linda, you bring
changes minute by minute.
absolutely. You bring up just a brilliant example of how this has grown. And I remember when they started making the partnerships with DBA, I think DBHDD was the first one. And then others came along because it worked so well to have the different agencies working collaboratively instead of that person getting off the phone and having to find a new place to call and start all over. They hand them off in this warm transfer, and that person never has to go to empty space again. They really are making it work on behalf of all the people who are seeking help, and it's a beautiful thing to witness. These partnerships have extended the value of this great resource. Kara, I didn't expect for you to talk about Thanks Mom and Dad Fund, but thank you so much. But I will say we are only as good as the eyes and ears of the people on the ground doing the work, and that's all of our AAA network. We listen to you, and that's how we're able to find out immediately what the needs were and how to jump in to help. I'm really excited. Today is the fourth delivery, final installment of a gift of 1.35 million masks across the state of Georgia now, at a time for our seniors and their providers to have access to this PPE at a time when this virus, unfortunately, is ramping up again. And so, again, we're very proud of the work that Thanks Mom and Dad Fund does, but we are informed by the work that you do. We recognize every single time that a little bit of help to one of the providers or the AAAs in the aging network, they leverage that money, take the information that they've learned and leverage it for, yes, the next iteration to share during this crisis and for the future. And so we believe that our money is best invested in the work that you're doing. So very much thank you to you and all of the people who work in the Aging Network. Thank you.
Thank you. We had people calling in tears, so thankful that we were able to get them groceries. We usually have them ordered and delivered the same day. And I tell you, we literally still can't access some of that federal funding just because of technology. But with Thanks Mom and Dad, it was the first one we could access and get out the door. So it made a tremendous difference.
Well, we're proud of the work that our network does, and anything we can do to help, we continue to try. We're concerned about social isolation as this drags on, and maybe looking further into that. It's a real problem, and we thank you for the work that you do, all of you on the phone, if you're a provider or related to the Aging Network. That includes Linda, DBHDD, all of the partners. Thank you for taking care of older Georgians and people with disabilities. Really appreciate it.
This is Jane with the Brain Injury Association. I just want to support the thank you also. I don't think I've not reached anybody that didn't offer that helping hand that I needed for the population I serve. It's just incredible, all of you.
Jane, I'm so glad. Jane is with the Brain Injury Association of Georgia, and she's another one of our partners that we collaborate with regularly. So Jane, thank you.
Mm-hmm.
And another early partner, as I recall.
Yes, you're right.
In a while, yeah.
Yay, congratulations to all of you.
Yeah.
If there are, there's, yeah, thank you. Everybody's expressing their thanks, but thank you. This will be posted. If there aren't any other questions, please look at the notes here on chat. David Kaufman, our executive director, posted all of the links for you. And if you lose that or don't remember that, it's thanksmomanddadfund.org, or in this case, it's thanksgala.org /post/how to find help for older adults. Or you can even see it on our page on Facebook. Our wish is that we can get this in front of as many eyes that need to see it, and we'll continue to do so as our pledge to you in support of your work. Thank you. Happy Thanksgiving, everybody.
Thank you.